by reading them again for you. Can we have mobile phones turned off, please, or at least on silent, vibrate alert, whatever is your preference on that front. Bit of housekeeping. I'm meant to read this. If you hear a fire alarm and or a PA broadcast, prepare to leave the building by the nearest exit. If you want me to do the air hostess thing, they're there, and at the back. Ensure that all persons within your group or area are accounted for. So look at the person next to you, remember who they are. If you like them, think about them. If you don't, let somebody else worry about them. Follow any instruction given by the resident staff and proceed to the assembly point by House of Fraser. Women, don't go into shop, you might need to come back. Do not use lifts, which is okay because we're on the ground floor, and return to the building without authority. Okay, did everybody knows where House of Fraser is? Out the door, turn left. Big shop, shiny lights. Right. My task is also to get you to start interacting with your chair for some bizarre and not exactly clear reason. In the pocket next to you, you have a TV remote control. If you'd like to take that out, I'm going to ask you some questions. As I don't know how to use the TV remote controls, I'll leave it for your own intelligence to work out how to do that. So if I can have the first question up, please. Okay, which of the following best describes the purpose of your visit today? Number 1, journalist. Number 2, doctor. Number 3, other healthcare professional. Number 4, other. If you'd like to press the button now. See, look, it says answer now. Isn't that good? Has everybody managed to work out how to use the technology? Yes, everybody press buttons, regardless of what you've done. Okay. You're lots of others. A couple of journalists, a few doctors and other healthcare professionals. Okay. Question number 2. Are you a snorer or a snorer's partner? Number 1, if you're a snorer. Number 2, if you're a snorer's partner. Number 3, if you are neither. You could actually be, but we haven't got that up there. If you're a woman, you are allowed to admit to being a snorer because I can't see what you're pressing. By the marvels of technology, something will happen soon. Ooh, little ripple of excitement. Ooh. Right. Okay. Well, there is a part B to this. If you are a snorer, are you male or female? We could dim the light so you can check, but you know you should be able to know. Thank you very much for those questions. These questions are actually going to sort of form part of the sort of outcome of the meeting today. They will be broadcast to the world later this afternoon. So thanks for doing those. There are some more questions later on. These form two purposes. One is to sort of show that you've paid attention, and the other one is to show that you've actually understood why you were here and you haven't wandered into the wrong meeting. So, without further ado, I'd like to hand over to our first speaker, who is Professor Raj Persaud, who is going to talk about relationships and how fragile they are, and also in the context of snoring. Raj, you'll probably all know from his work in the media. If you look on his website, there are 1,001 flattering comments about him, which I won't embarrass him by repeating. They're there for you to see. But he is a consultant psychiatrist at the Bethlem and Maudsley hospitals, and he is also Gresham Professor of the Public Understanding of Psychiatry. He's published over 100 peer-reviewed papers, and he has 2 best-selling books. So without further ado, I'd like to pass over to Raj.
Thank you very much for that. I don't know if you immediately noticed the vast discrepancy in height between the chairperson and myself, but this is why I'm going to have to raise a lectern rather embarrassingly, I think. But I won't raise it any higher than that, then I'll disappear behind it. I'm very pleased to be invited here this morning to talk a bit about quite a new subject, I think, something that doctors and the media are not aware enough about, but the impact of snoring in terms of the quite grave medical consequences, but also the grave psychological and relationship consequences. And they are quite serious consequences, and it's difficult, I think, for the media in particular to get its head around this, because the media tends to regard snoring as quite a light-hearted, quite understandably perhaps, subject. And I think it's important not to lose one's sense of humour when talking about snoring. And there may be one or two things that I'll be saying later on this morning that you may find slightly humorous on the subject. But it is a subject that is serious. It does have serious consequences in terms of people's relationships and medical problems. And some of the data I'm going to be talking about, which has arisen out of a survey recently commissioned, is new data. And I'm a bit nervous talking about it. Because whenever I do anything for the first time or present something for the first time, something dreadfully wrong always seems to happen. I recall, for example, the very first time I did a live televised phone-in, and I think that went slightly wrong when I did that. Some of you may know that besides being a consultant psychiatrist at the Maudsley Hospital and Gresham Professor for Psychiatry, I have been known to make the occasional broadcast on television and radio. And one of the programs I have done for a while in years past is a program called This Morning with Richard and Judy, a popular daytime television program that used to be on ITV and used to be hosted by a couple, a married couple, and we will be talking about married couples and the tensions between them, a married couple called Richard and Judy. And I used to do a live televised phone-in on this program where people would ring in with various psychological or emotional problems. And it was a very challenging experience because you didn't get a chance to talk to any of the people who rang in before they were live on air. So you only had a brief moment in which to make a brief assessment live on air and give some kind of advice or help, which is a very challenging experience. Now, if you are a regular viewer of this program, given it goes out during the daytime between 10 and 12 in the morning, 5 days a week during a weekday, then if you are a regular viewer, you're either very good at skiving off work or you suffer from some kind of chronic illness. When people used to recognize me in the street and come up to me, I'd often have to try and work out which it was. The program has been going for about 10 years, and it was about 10 years ago that I first did the program or appeared on it. And it was around the time of the death of the MP Stephen Milgram, who you might remember died in circumstances strongly suggesting he'd been taking part in the fetishistic practice of autoerotic asphyxia. Now, this was a key moment in the history of when journalists reported politicians' behaviour. Journalists threw up their hands in alarm at this very bizarre phenomenon, autoerotic asphyxia. And they said, we really do not understand politicians. This autoerotic asphyxia is such a strange thing. So the press turned to me and asked me to write an article explaining what autoerotic asphyxia was. And I duly wrote my article, which appeared in the national press the next day. And Richard and Judy read the article and thought to themselves in typical daytime TV fashion, why don't we do a phone-in on fetishes and perversions at 10:30 in the morning? So they invited me onto the program for the very first time. And as I said before, it's a very stressful experience being in the studio, but Richard and Judy are there, which can be helpful at times. And the first few calls came in, and they were sort of fairly standard questions on fetishes and perversions, if there can be such a thing as a standard question on fetishes and perversions. So I did this very dangerous thing that you should never do on live television. I began to relax. But then this woman came on the line, and she had this question for me. She said that her husband had been perfectly happy to make love to her on a fairly regular basis in the privacy of their bedroom for the first few years of their married life. But recently, mysteriously, he'd gone off wanting to make love to her in the privacy of their bedroom. And now, the only time he wanted to make love was when he came home after a long day at the office and found her washing up the dishes in the kitchen sink. And for some reason, this sight of her washing up the dishes in the kitchen sink would turn him on rather alarmingly, and he would insist on making love to her there and then on the kitchen table. And basically, she wanted to know why this was. Well, the cameras turned to me. I was suddenly aware for the first time of the heat of the studio lights and the fact that there were around 10 million viewers out there waiting for an answer. And I have to say that nothing immediately sprang to mind. It was one of those moments in your life where you feel a geological age is going by. I opened my mouth. I'm not quite sure why I opened my mouth, because I didn't know what was going to come out of it, when all of a sudden Richard turned to me and he said, "Actually, Dr. Persaud, I think I know what you're going to say." I said, "Do you, Richard?" He said, yes. You see, here's a chap, he's pushed around all day at work, bottom of the pile at the office, has a really hard time, bit of a minion, and this is getting him down. And then he comes home after this very negative experience being the bottom of the hierarchy at work, and there's his wife, washing up the dishes in the kitchen sink. I mean, after all, when she's doing that, she's playing a very housewifely, subservient role. I mean, after all, there she is with the yellow rubber gloves, the little white pinafore. And because she's playing this housewifely, subservient role, for the very first time in his day, this man feels dominant. And because he feels so dominant, this turns him on. Now, that's what you were going to say, isn't it, Dr. Persaud? So I turned to him and I said, yes, Richard, that's exactly what I was going to say. So now I've demonstrated my intellectual credibility to you. I want to talk a little bit about snoring and some other words that you will be hearing later on this morning, obstructive sleep apnea, for example, which will be described in more detail by some experts later on this morning. But the first important point I want to make is that snoring as a problem is known way back to ancient times. And in fact, the Greek word for sleep has a very similar root to the word for snoring. So the ancient Greeks actually associated the two very strongly. And there's even a reference in Virgil's Aeneid to snoring, where he includes in just one sentence the three key risk factors that we're aware of today: obesity, alcohol, and position. He mentions these in a single line where he says, "Who gorged and drunk with wine, supinely snore." A potential, albeit radical, solution is also mentioned. He writes, "With his drawn sword, him and his sleeping slaves he slew." The treatment of snoring has happily moved on a little since Virgil's day. But the important point to make is that snoring is very rooted in medical history and has been well known for millennia. Another thing that people may not realize is how common it is. Surveys suggest that between 25 to 40% of adults in the UK, this is excluding young people or the elderly, regularly snore. And that suggests that basically 10 million UK adults experience problems because of snoring. And that's quite a large figure, really, a phenomenal figure. That's more than the number of people who suffer from asthma. And yet the media gives asthma a lot of attention and snoring really very little indeed. One of the problems, of course, with snoring, one of the big medical conundrums, is how to measure it. And it's a very difficult thing to measure because it only occurs often when people are sleeping, and often people themselves are unaware of it. And this is one of the conundrums that goes to the heart of studying the problem, which is why we may not know as much about it or may be aware of it as we should be. But one study, which actually used microphones to measure people's sounds while they were sleeping, found that 80% of men, this is ordinary average men, snored for more than 10% of the night, and 20% snored for more than 50% of the night. So in fact, the probability is the case that most people in this room snore. It just may not cause them problems necessarily, or they may not be aware of it. Snoring is linked to obesity and being overweight, and it's a particular problem for women to admit to, and often male partners are loath in particular to mention to a female partner that she snores, because there may be a bigger stigma around that for women than there is for men. But for example, in the third trimester of pregnancy, it is well known that many women begin to snore for the first time. So it's a very common problem. And another survey found in nursing home residents, up to half have clinically significant sleep apnea, and that's a problem very strongly linked to snoring. But what exactly is snoring? Again, you're going to have some experts talking to you later on this morning who will describe in more detail and perhaps a lot more precisely and accurately than what a poor psychiatrist can do in describing what's going on in snoring. But to put it very crudely and roughly, there is a muscular tube that constitutes part of the connection between your lungs and your mouth. And when you're asleep, the muscle tone in that tube often goes down, and if you're overweight or sleeping in a particular position, that tube can collapse. And you may take greater expiratory effort or inspiratory effort to open the tube, and that causes greater air turbulence, and that is a sound that you will hear when someone begins to snore. But what are the consequences of snoring, or the sleep-related problems linked to snoring? First of all, there are a whole set of consequences linked to the problems of sleep deprivation. Often people who snore or have obstructive sleep apnea don't get a good night's sleep. So the next morning, they haven't benefited from a refreshing night's sleep. They suffer from all sorts of problems linked to that. For example, concentration is down, memory is down, work performance suffers, they'll feel tired and sometimes even depressed. All the consequences of sleep deprivation. And there can be very, very profound psychological consequences for sleep deprivation, which is why sleep deprivation is the favourite tool of torturers, for example. One study found that the number of car accidents is significantly increased in people who snore or suffer from sleep apnea, because perhaps of a reduction in the ability to concentrate. Another study found that among those who snore, the relative risk of having a myocardial infarction or a heart attack went up by a factor of 3. If you snore regularly, you are 3 times more likely to get a myocardial infarction. Also, other medical problems include other heart disease, but also high blood pressure is linked to obstructive sleep apnea, with approximately a quarter of patients with high blood pressure suffering from obstructive sleep apnea, and more than half of patients with obstructive sleep apnea have systematic high blood pressure. And there's a multifarious number of medical problems and psychological problems that arise out of snoring directly for the sufferer. But just to mention one more obscure paper, but I think very interesting and fascinating finding, was that people who suffer from nightmares, or an increased prevalence of nightmares, are more likely to snore. And one theory is that the snoring somehow is leading to nightmares, maybe through the pathway of the fact that these people are getting a disturbed night's sleep, or maybe more, as a result, therefore more anxious about sleep, and therefore they have more anxiety-laden sleep. Now, the key thing about snoring is that it's a very unusual medical problem, despite the profound impact it can have on people's lives, because many people aren't aware of the symptom. The symptom occurs when they're asleep, so they're oblivious to it very often. In fact, the person who is most aware of it is their partner or the person they sleep with. And often, actually, in the short term, it's the person who they sleep with that suffers the most consequences. And they're the ones that suffer the consequences of the loud noise of snoring keeping them up at night, but not just the noise, the fact that the person who is snoring might have themselves disturbed sleep, so they toss and turn in bed, or they get up at bed to go to pass urine in the loo, otherwise known as nocturia. And it's all this disturbed sleep that the partner is suffering from that leads to problems. And it's well known that the partners of significant snorers have many problems. One study found that women exposed to loud snoring not only have a higher rate of health complaints, but that included hearing loss, which can indicate how loud snoring can get. The recent survey, the data of which you'll be hearing a bit more about this morning, found that over half of partners admitted that they argued about snoring. Because you can imagine that married life is lively enough in terms of disagreement over things which are publicly verifiable. Imagine what it's like for a married couple to come to an agreement about something that one of them just simply is unaware of. So often it leads to a lot of arguments and a lot of tension as a result. Often a person goes to a clinic at the admonishment of their partner, when doctors are assessing patients, that they see the partner as well, and that can often be problematic. Another technique that doctors often use is to record or ask that snoring be recorded, and that can be very helpful, raising an awareness of the snoring is actually occurring. But there's a lot of evidence, there's a long-term emotional strain sleeping with a partner that arises out of snoring. And some suggest that the behaviours are serious enough, and doctors reported this in the medical literature, enough to lead to divorce. The most recent survey that is being presented to you this morning found that basically 1 in 4 snorers hardly ever make love, whilst basically a third of for a third of snorers, serious snorers, lovemaking occurs less than once per month. And this is obviously going to have quite a big impact on married life. And this is happening for all sorts of reasons, not least because the survey found that at least 70% of people where snoring is a big part of the relationship actually sleep in separate rooms. And again, there's a taboo and stigma around this subject, so that it's very unlikely that partners may even discuss this with the GP. But obviously, if people are sleeping in separate rooms as a result of the problems that arise out of snoring, then that's going to have a massive impact on people's relationships. But another impact is through the fact that the medical problems linked to snoring can lead to reduced sexual drive. And another recent survey found 50% of people suffering from problems to do with snoring were also experiencing erectile dysfunction. And that obviously, again, is going to lead to a deterioration in relationships. So I want to talk just briefly about what people can do about this. First of all, I want to talk briefly about relationship quality and some tips and advice about how to deal with relationship quality. I do a lot of marital therapy in my work at the Maudsley, and one of the big problems that married couples get bogged down in is the conflict between what is right, what is the truth, and what actually would be most helpful in terms of the survival of the marriage. And many couples are getting into a fight about the reality or the truth of whether clinically significant snoring is actually occurring. And some of the work I do with couples is to get them to move away from the issue of who's right and who's wrong, and to think about what's best for the survival of the marriage. And one of the things to do in my work with them is to get them to understand the value, the true value of a great marriage. And of course, the economists have come up with a very prosaic answer to this, because the economists have calculated the value of a marriage in strict commercial or monetary terms. And the way the economists have done that is calculated how much it would cost you to go and buy on the free market or the open market all the services that a married partner provides. Someone who cleans the house or looks after you and your children, provides sexual services, etc., etc. And if you add up the cost of all the things it would, on the free market, it would cost you to buy all the stuff that a diligent and caring married partner provides, it roughly comes to about £100,000 a year. That's, in other words, the commercial value of a great marriage. That's what you're getting for free in pure harsh economic terms from having a great married partner. Now, in my experience, telling a married couple who are in trouble that basically the marriage is worth $100,000 a year sometimes works, but often one technique that's famous in marital therapy is actually to tell the married couple that the relationship is in fact over and that you are somewhat surprised that they're trying to rescue it. Married couples are usually very upset that you make an initial assessment when they come to you in trouble that you can decide so rapidly that actually the marriage is over, and they're outraged at this. And for the very first time in their lives, they unite to attack you, that you should have the temerity to argue that their marriage is indeed over. But in fact, I mean, I've seen married couples, for example, who have argued and literally end up sleeping in separate bedrooms or separate houses over fights as relatively trivial, for example, as whether the 3-year-old in the house should have stabilizers fitted or not fitted on their bicycle. So one of the things that happens in my marital therapy is I'm telling a couple that the marriage is over, and they're arguing with me about that. So it turns a little bit into like the dead parrot sketch in Monty Python. I'm saying this is a dead marriage, it's over, it's finished. And they're going, no, it's not. Look, nice plumage. And I'm saying, no, this marriage is nailed to the perch. But eventually, when people can see the danger that if they keep going down the route of arguing each other, that this valuable thing will be destroyed, they can come round to seeing they have to resolve the conflict between the truth and getting things right and the truth about whether someone's snoring or not, and actually thinking about what's best in terms of preserving the marriage. Some other tips I want to give you about a relationship would be to go on a date once a week. Now, it's very interesting, the psychology of this. When people first meet and they start to try to seduce or woo each other, they do go on a date at least once a week, perhaps even more than that. And the psychology of going on a date is the idea that you go and do something pleasant of an evening, and you want the other person, and there's actually quite a lot of deep psychology in this, you want the other person to associate you with having a good time. So you generate pleasant events of an evening. You go to see a nice film, or you go to the theatre and have a nice meal. You want them to associate you with positive experiences. Now, let's move fast forward in time 10 years into a marriage. What happens 10 years into a marriage is a marriage partner associates you with discussions about the mortgage, the plumbing not working, problems with the kids. In other words, they associate you with negative events, which is often why people go off and have an affair, because they can then associate, they go off for having the one date a week with the person they want to have an affair with, because they associate the person with the affair with positive events, and they no longer associate the married partner with positive events. So the rule that I make, and it's in one of my books called Staying Sane, is that to ensure the long-term survival of your marriage, you must go on a date once a week. And again, it's amazing how many married couples don't take that seriously. It's got a huge amount of psychology in it. Often when I ask a married couple, when was the last time you went on a date, just the two of you going out together, the man can't remember. The woman can. And she will say something like, it was February the 3rd, 1974, we went to see The Sound of Music in the cinema. That's how long ago it often is that a married couple have been on a date. Now, the other rule is that when you go on a date, you are not allowed to discuss problems. If you go back to when you first meet someone, you're trying to woo and seduce them, you don't spend the evening on your date discussing problems with your job or your life, whereas that's what married couples do when they go on a date. So you're not allowed to discuss problems. Now, when I did a phone-in recently where I gave this advice, someone rang in and said, now this advice about not being able to discuss problems, suppose there's an emergency and the kitchen is flooding because of a problem to do with the plumbing. Are you not allowed to discuss that? Well, obviously, you are allowed to discuss emergencies, but generally speaking, you're not allowed to discuss more mundane problems. And the research in terms of a healthy marriage also suggests, and here's my other big tip, that you must compliment your partner on 5 separate occasions every day. There has to be 5 compliments a day. And the research evidence indicates that if you do 5 compliments a day, that is strongly linked to marriages that survive. One other little measure of the quality of your married life, and this is a very dangerous, somewhat controversial, but actually powerful measure that marital therapists use, because men often relate better to numbers, I find, when trying to assess quality, so you have to give them a number to think about, is you add up the number of times you make love as a married partner, married couple, in the average month or the average week, and you subtract from that the number of times you have a row in the average month or the average week. Okay, so the number of times you make love, subtract from that the number of times you have a row. Now, if the number is 0 or negative, you have a negative number, then that's not a great sign in terms of your marriage. You want to be hitting positive numbers. Again, now, married partners, I've seen this, actually get into a fight about what constitutes a row, or the definition of a row. Okay, I personally think it's kind of obvious what a real married row is or isn't. Okay, to conclude my talk then, some motivational tips about how to deal with this problem of snoring in terms of the emotional consequences in relationships. The first thing is that people are most worried when there are major consequences. It's very difficult to motivate people to do something about snoring when they think, well, so I'm snoring in bed at night, big deal, what's the big consequence? Because they're often the ones not experiencing the sleep deprivation. It's a very useful thing to catch the person falling asleep and snoring in a public place, like in the cinema. And you wake them up and you say, I'm waking you up because your snoring was really loud and it was troubling other people in the auditorium. And then people often catch on to the fact that snoring is an issue if you do it in a public place. Another key tip is to record the snoring, because if you can record it and play it back, then that often brings more insight. A key point at the heart of human psychology is don't focus on what the problems are, Focus on what could be better in the future. In other words, if you fix the snoring problem or the sleep apnea problem today, look at how much better our future would be in terms of problems you're experiencing now. Let's say fatigue or sleep deprivation, or our sex life will improve. So focus on the benefit rather than the problem, because in focusing on the problem, people get very defensive about the idea that they have a problem or are snoring. And one final point, and this is a key point at the heart of human psychology, is that people never like to be told that they have a problem. People, however, are very keen to fix your problem if you've got one. So it's always wise and helpful to present the notion that someone else has a problem as your own problem. So if someone has really, really smelly feet, for example, in a couple or a relationship, you don't say to them, you've got really, really smelly feet. And it's frankly a bit nauseating, because people get defensive if they get accused of that. What you say is, you know something? I've got a really, really sensitive nose. And it's a terrible problem, my really, really sensitive nose. But it would really help me with my really, really sensitive nose if you could deal a little bit with your feet. In other words, you've turned the problem round to say that you've got the problem. And the same thing with snoring. You could say to the other person, I'm a very, very light sleeper. It's a real problem. And the slightest noise wakes me up. In other words, in owning the problem, you could often persuade the other person to do something about it. I'm running out of time, so I think I'm going to have to think about closing there and take any questions from the floor. Thank you very much indeed. So if you have any questions or thoughts or any other experiences in terms of married life or couple life in terms of how snoring impacts, I'd be happy to take any comments or questions.
Dr. Persaud, do you have any views on the use of sex as a punishment or as a tool to motivate, or how sex and snoring can interrelate in that way?
Yeah, I see that a lot in the marital therapy that I do at the hospital, that often sex can be used as a weapon or an incentivizing device. And I think that is often very, very unhelpful when that begins to happen in a relationship. And usually what then is happening is that a lot of a hidden aggression or anger is occurring in the relationship. And a large part of marital therapy is about getting people to ventilate about the anger that they feel before they can move past that and think about fixing the relationship. It's really amazing, but some of the deepest hatreds you see in life occur within a marriage, which is again why I often start off by saying maybe it might be better if the two of you separated and get people to fight for the marriage and therefore get past a lot of the hatred and anger. Another thing that then occurs is people get locked into the past and have a lot of resentment about the past. And you've got to try and get married couples to think about the future and move forward to trying to save the marriage. And one of the big powerful bits of advice we give, and it's very powerful in marital therapy, is called a change for a change. So it's about the idea that I want you to make a change, okay? Like I want you to go and see the doctor about your snoring, which is a change that I want you to make. But what we do in marital therapy is we say, well, what change are you prepared to make that the other person may want? Because you want them to make a change. What change can you offer that they may want? So that it's not just that one person is seen to make a change. Now, often a lot of married people feel this is unreasonable. They say, well, it's obvious he should go to the doctor about his snoring. I shouldn't have to make a change myself to produce that. But usually the way you motivate other people to make a change in a marriage is for both sides to be making a change in some description. And that's really the way marriages move into a positive spiral out of trouble.
I'm a surgeon and I deal with patients who have snoring problems, and one of the things where surgeons are asked to do is to try to measure outcomes of success. And there was a study in America, you may have read it recently, that they decided to try to measure the outcome of success in terms of marital couples who had split the marital bed and the extent to which women would get back into the marital bed after the snoring was stopped. And surprise, surprise, they found that actually a lot of women quite enjoyed sleeping in separate rooms, separate beds. They didn't like the advances the husbands were making, and they got used to being able to sleep alone. Do you feel that this might be overstating, or do you think quite a lot of women actually find that when they do sleep in their own bed, in their own space, it is actually sometimes better for them than having the service of a husband right next door to them, whether he's snoring or not?
Yeah, and I think it's a good point. And in fact, some surveys find that although snoring does cause a lot of disruption, and there seems to be very, when people study it, they find very low marital quality in relationships. The difficulty is finding a relevant control group. And when you find the relevant control group of people of roughly the same age, roughly the same health, just as no snoring, you also find, alarmingly, there's very low marital quality in the control group. Marriage and maintenance of relationships is a tricky issue all in all, and a problem like snoring can tip the balance into negativity. But taking on board your point, I think that often what's happened is, by the time people have split up, you see, the snoring has been going on for so long, instead of splitting up in terms of moving marital bed, the snoring has been going on for so long, or other problems have been going on for so long, that the marriage has several entrenched difficulties, that even when you fix the snoring now, you still got to get over things like the resentment of how long it took for the person to go and get help, and other stuff that's going on. So although fixing the snoring is a vital part of improving the marriage, if it's been going on for a long time, and these are often very chronic problems, there are other things going on in the marriage that need fixing. There is another very interesting and very tricky subject we need to confront in that point, which is about sex drive between men and women, which is a deeply controversial issue, and something that psychologists have been looking at for a long time, about, is it the case, as the media likes to make out, that men have a stronger sex drive than women? And it's a very tricky question to answer. And there was a very novel recent study that tried to answer this, because the study said that determining who has the biggest sex drive when you're dealing with heterosexual couples is a bit tricky, because the standard measure, which is the number of times they have sex, may not be a measure of how many times either side really wants to have sex. Okay? And it may well be that someone's agreeing to have sex, but they're kind of agreeing to it. They don't really, really want to have sex. So they did an interesting thing, which they looked at homosexual couples. They looked at gay men and gay women, and they followed them up over a long period of time. And what they found was that gay men continued to have a fair amount of sex, quite a long time into the relationship, quite a large amount of sex, frequency of sex with each other. But gay women, i.e. lesbian couples, the amount of sex did drop off significantly compared to the gay men. And the theory here is that maybe this is an indicator that women do have a slightly lower sex drive than men over a period of time in a relationship, and it does drop off. And that may again be one of the things that you're finding from your study. But again, marital therapy and psychosexual counselling can work on that, so that both sides come to a mutually satisfactory, more positive sex life, I think.
Personally, I think the ideal situation is where, if you can afford it, you have an arrangement like the Queen and Prince Philip have, where you have separate bedrooms, and indeed all through history, the very rich would always have separate bedrooms, and you can sort of creep along the corridor when you want to, but you can separate out and have a good night's sleep, and I think for many people that would be an ideal arrangement.
Yeah. So what you're kind of saying is they need to get a bigger mortgage, which, yeah. It's amazing how the ripple effects in terms of the changes we as doctors require of people. I know of couples, for example, people sharing flats, not couples are cohabiting, where one person's smoking and the other one isn't. And I would have to say to them, well, look, I don't think you're going to be able to give up smoking. If you're trying to give up smoking, if you've got someone in the flat who's also smoking, it's too difficult. I think you're going to have to move house. And often there are some quite big lifestyle changes we demand of patients if they really are going to attain the goal that they desire. So I hope that's answered your question. Any other thoughts or questions? There's one down here at the front.
This is just about the decibel level of smoking, so it might be a clinical question that I need to ask somebody else, I don't know. But my experience of a partner who snores very, very lightly but disturbs my sleep, and whether his health is being compromised. Is there a link between the sort of loudness of the snoring and the physical impact? Or
well, the scientists that will be talking later on this morning, I think, will be able to address that question directly. But what I'm more interested in is, because you're able to assess the loudness, does he take on board your assessment of the loudness of the snoring? Does he, when you...
Recently, yes.
Okay.
It's
What?
taken a long time.
You see, this is the interesting area, I think, in terms of the couples having a dialogue with each other about something that one of them is just totally unaware of. Why do you think it changed? What do you think happened?
Because I, for some instinctive reason,
Right.
And when I tried before to point out that he had a problem, we weren't going anywhere.
Yeah, yeah,
So it was me changing that
yeah.
that changed it, which is why I'm here, because we found out about the British Snoring Society and stuff.
Yeah. Well, there is an art, a very delicate art, in terms of trying to produce change in a married partner without it seeming as criticism, which produces a defensive reaction. So it's about handling that situation very carefully indeed. Which in fact is often why sometimes it happens in a marital therapy session, that people come for one problem and then a whole series of other things they put on the agenda to be raised. And it's interesting, they put it on the agenda when they're with me, but they can't put it on the agenda to be raised with each other outside of the session. But I think your question will be answered later on this morning. There was a question at the back, I think.
Could you speak a bit about how the shortage of oxygen affects the body and the mind caused by sleep apnea?
Yeah, I mean, there's a lot of evidence that sleep apnea can have very, very profound effects in terms of brain functioning. And for example, literature coming from a completely different area, looking at people who have an anaesthetic and people who are undergoing major cardiac surgery and get deprived of oxygen for a period of time, find that many of those people have lower IQs, for example. So there's quite a profound effect of oxygen deprivation on the brain in those areas. Again, the scientists who will be talking later on this morning will be able to talk to you in more detail about what's known about that in terms of actual measurement. But my sense of the data is that it certainly has a profound psychological effect in terms of neuropsychological measures of things like memory, concentration are definitely affected. And it's clear from the data about car accidents and also work performance that people's brain function just doesn't work so well. And it doesn't just not work so well in terms of cognitive skills, but emotional things as well. There is some evidence of elevated rates of depression, for example, of people who are suffering from snoring and snoring-related sleep disorders. So it's a very serious problem. But one of the problems is to make the diagnosis properly, you need quite a lot of well-equipped laboratories, sleep laboratories. And the NHS is woefully inadequately funded in terms of sleep laboratories, I think, in my opinion. Again, it'd be interesting to hear what the sleep researchers have to say, who will be talking to you later on this morning. But when people come to me with just sleep disorders in general, the ability to refer them to a sleep laboratory that can make the diagnosis definitively is very inadequate. And yet sleep is one of the commonest problems that people go to their GP with. I mean, drugs that help you sleep at night are some of the most commonly prescribed drugs that GPs prescribe. So again, it's a very, very odd situation that sleep medicine, in my opinion, is so woefully and inadequately funded by the NHS. There was another question, I think, back there. No? Okay. If we're out of questions, I think we might draw my presentation to a close and invite the next, the chairperson to invite the next speaker to the stage. Thank you very much indeed. Thank you.
Thank you very much. Just to say, if some of you haven't actually noticed, this is the launch of the National Stop Snoring Week. That's why you're in here. And so that was an excellent presentation talking about the relationships, but now we're going to talk about snoring. And my good friend Robert Royston, who's clinical scientist excuse me, at the Royal National Throat, Nose and Ear Hospital here in London, is actually going to make loud noises at us and explain something about snoring and perhaps answering the question about the difference between subjective disturbance and objective disturbance. Is loudness important within the snoring? Just another housekeeping message. We are depriving you of caffeine until the end of the meeting. So if you want to pinch the person next to you to keep them awake at any time, and if anybody snores, talk to Raj. He knows what to do with them. This public humiliation. So I'll pass over to Robert. Thank you very much.
This is where we hope it works, don't we? Interesting discussion. I have to take account of take issue with the fact that something as inconsequential as stabilisers on a bicycle for a 3-year-old when you're as keen a cyclist as I am, and you hope your son's going to be the next Eddie Merckx, it's a very important issue in your household. Although he's now 14, so he doesn't need stabilisers. Yes, my role as clinical scientist at the Royal National Throat, Nose and Ear Hospital is I'm involved in the sleep laboratory there, and have a particular interest in snoring and a particular interest in the measurement and analysis of snoring. It became very clear to me in a very short space of time of being at the hospital that actually there wasn't really a definitive way of measuring snoring. We do measure it in the laboratory, but we don't measure it in a definable way. And I felt that actually that was something that was wrong. We needed the ability to measure it. We needed the ability to assess just how bad a problem or how little a problem it is. And we also needed some ability to assess whether treatments, be they surgical or non-surgical treatments, actually do work or not. We've heard a bit about the concept that around 40% of the nation snore. This was a telephone survey done in 96, 97 by Hanyan and published in the BMJ. About 5,000 people there. Interestingly enough, more women than men in that particular survey. Maybe that's because they're at home watching Richard and Judy, and when they answer the phone, I don't know. But age 15 to 100, 40% of those reported that they were snoring, they snored, and that around 4% actually reported breathing pauses, something we know as apnea. Now, being from a scientific background, I don't want to bore you too much, but I need to talk a little bit about sound. What sound is. It's a stimulating phenomena that gives rise to an auditory sensation. And that sensation can be very different according to the different sounds that we hear. And snoring, the sound of snoring, is sound that's produced either by the turbulence of air, or that turbulence causing vibration of soft tissue and muscle. And the sound will be different depending on what's happening to the individual's airway. Ignore this slide. We measure sound. If we want to measure sound, you might have heard people talk about decibels. I have to bang the desk here and say there's no such thing as a decibel. We've got to talk in absolute measurements. We talk in decibel sound pressure level. That's something that we can measure and something that we can compare one measurement with another measurement. And it became absolutely clear to me in reading scientific papers, published scientific papers, that people were not making meaningful measurements that were comparable. And that's something that I wanted to rectify. So we measure sounds in something called sound pressure level, which relates just about to 0 being about the quietest sound that we can hear. So we know it's a scale relative to that. But perhaps what's even more fascinating, and this is where the psychology comes in, is that loudness is actually not something we can measure. We can measure intensity, but we can't measure loudness. Loudness is a psychological attribute of sound. What appears to be loud to someone may not appear to be loud to someone else. Loudness of a sound depends on what that sound is made up of as well. Certain sounds will sound painfully loud to us, and yet another sound of the same intensity, if we measure it and it has the same intensity, may not sound quite as loud. In fact, we have these wonderful curves called equal loudness contours, which the psychoacousticians developed over years, which actually tell us that if we actually look at our hearing, this is actually a plot of frequencies. So like pitch, these are the lower pitch sounds, these are the higher pitch sounds. The lower pitch sounds, because our hearing is not very good at responding to lower pitch sounds, sound nowhere near as loud as the middle or high pitch sounds. And so the actual content of the sound is very, very important into how we perceive loudness. And the perception of loudness may come back to the psychological aspect of what's a problem for one person isn't a problem for another person. So although I bang on the desk about how important it is to measure accurately the sound, loudness we can't measure because it's a psychological attribute. And when we try and relate what we measure to what people perceive as a problem, it may not always match up. Snoring, respiratory noise during sleep, typically on inspiration, not always, but typically as you're breathing in. caused by reduced muscle tone in the airway, we heard earlier on, and a reduction in your airway, that tube that connects your mouth down to your lungs. That reduction in the airway can actually cause this turbulence of air and oscillation of structures. That's just showing a picture where we can see that there's turbulent air flowing down a reduced airway, and we get this vibratory picture. There are effectively four types of snoring, hyperpharyngeal, epiglottic, tongue-based and palatal snoring. These basically relate to the point along the airway where the sound is emanating from, the vibration of the tissue or the oscillation of the air. There is a technique, a surgical technique, where we can actually examine patients while they're asleep using endoscopy to identify where that source of snoring is. And the source of the snoring is quite important because it determines whether certain surgical treatments are an option for individuals or not. We've heard a bit about the health effects of snoring. I don't want to go into this in too much details. Fragmented sleep, poor quality sleep is the most likely thing. Not just for the snorer but for the partner as well. Poor quality sleep continuous poor quality sleep results in a sleep debt, where actually you end up being sleep deprived, you have a sleep debt. You get reduced daytime cognitive function, you're unable to sort of remember things or function correctly, an increased accident risk. And if it's associated with pauses in breathing, disordered breathing, there's an increased cardiovascular risk. So there's a significant health effects. And what's interesting about the cumulative sleep debt, some very recent research has shown that if you're in sleep debt, you are likely to have a much greater increased heart rate variability, increased cortisol level, which is a stress-related hormone, so you're likely to be a more stressed person, a reduced glucose tolerance and a decreased insulin sensitivity, and decreased leptin levels. And leptin actually controls our hunger and appetite. And decreased leptin levels actually mean that you are regularly more hungry and more craving of food. And that decrease is even larger in people who are obese. So if you're obese and you're suffering sleep debt, then the likelihood is that you will just crave food. And interestingly, you tend to crave the carbohydrate food, which just exacerbates the problem. So it is an issue in terms of if you're in sleep debt, it's going to affect your health, it's going to affect your weight. Sleep debt makes you fat effectively. We've heard a lot about the social effects of snoring, relationship difficulties, disrupted home life, and restricted social activities. People come along and they say, well, I'd like to go away with my mates at the weekend, but we'll be sharing a room and my snoring will keep them awake. I had a sailing teacher who takes people off for weekends to teach them sailing, and they sleep on board the boat. He said it's a major problem. The boat's vibrating. They never come back as customers. So why should we measure snoring? Well, we need objective evidence of snoring, to be honest. If a couple come to us and the partner's saying, well, my husband snores, I can't stand it, we sleep in a separate room, we actually need proof that they do, because amazingly, sometimes they don't. And maybe it's being used as the tool to get them out of the room. We need to get an idea of the severity of the snoring and what sort of level the snoring is. And we need some method of assessing surgical success, which up until now, realistically, has been done very subjectively. Has it worked or not? Has the snoring reduced? And maybe we can identify apnea, because apnea is pauses in breathing, and there may be some way that we can identify those from the sound possibly, and identify the source of snoring. I'm particularly interested in the different types of snore, the different sounds of snoring, and whether we can analyse that sound to identify the source of the snoring and decide whether someone is suitable for surgery. And what I'm also keen on doing is trying to do this in the home rather than in the laboratory, because I feel that the home environment is the right environment to make those measurements. Very quickly, I'll just mention about obstructive sleep apnea. It's been mentioned before. One of the worst case scenarios is that your airway completely closes and you're unable to breathe. You're trying to breathe against a fixed obstruction. And obstructive apnea is a very, very serious condition. It has major health effects and is easily treatable. And there are typical sounds, and we'll hear some of those in a minute, as to how we can identify sleep apnea in the home. What I wanted to do as a scientist engineer working in this field is I wanted to standardise the recording of snoring, because actually we don't have such a standardisation. We need to be able to compare our data between centres, and so to do that, being from an electronics background, I teamed up with an electronics company to produce the Snorometer, which is actually a bedside device, microphone mounted, which will measure up to around about 10 consecutive nights of sound at the bedside, allows you to record what we call a trend in sound level, but also record true snoring events, which may be replayed and analysed when you download them onto your PC. This is a typical picture, a 30-second picture, showing what a sound pressure level trace would look like in a loud snorer. And we can see on the scale on the left-hand side, we can see these are peaking at around about 80 decibel sound pressure level, which is a fairly loud sound, not uncomfortably loud, but a fairly loud sound. To give you an idea, if you were looking at noise exposure in the workplace, there's a European directive that tells us that realistically we shouldn't be exposed to much more than 85 dB SPL for continuous periods of time without the risk of hearing loss. So there is a possibility that very, very loud sounds could actually cause hearing loss of the individual and also of anybody who happens to be in the near vicinity. That's what the pattern looks. It's very easy to pick up snoring because it's related to breathing, so we know exactly the periodicity of the snore. And that's what it looks like if we look over the entire night. That's showing 6.5 hours overnight recording. And it's fairly easy to see from this recording. Oops, I've gone on now. Where's the mouse? There it is. That these are periods of snoring and these are periods of no snoring. It's very easy to identify snoring events from non-snoring auditory events as well, such as an aeroplane going above or a car going past. But this particular subject has shown that there are periods of snoring, long periods of snoring, but interspersed with no snoring. And that's just showing you some typical traces of, at the top there, this is a subject who actually didn't snore at all during the night. A little rise in sound pressure level there due to traffic noise, I think it was. This is a very light snorer. We've just got shorter periods of low-level snoring. This is the subject we were looking at before with long periods of loud snoring. And interestingly enough, this is the snoring pattern of somebody with sleep apnea, where we've got bursts of sound interspersed with bursts of silence. And these are easily identifiable from an auditory recording. Right, this is where the technicalities get difficult. So what's in a snoring sound? Well, let's have a listen to them. We can't listen to no snoring because that's silence. Having said that, of course, we make noise when we breathe. And no one has actually defined what a snore is. I mean, it's respiratory noise. But if you're a heavy breather, that could disturb your partner, one would assume. But maybe we wouldn't class that as snoring. So one of the things that in the next few years I'd like to do is actually come up with a definition for what snoring is. It's probably a nightmare to do that. Let's see if we can have a listen to some quiet sounds. I've got to do some flicking around here to my other software package. This is where we're able to look at sounds. This is a 30-second recording of what we would call a quiet snorer, with peaks going up to about 60 dB sound pressure level. To give you an idea, a typical background noise level in a bedroom, in a quiet bedroom, would be around about 30 dB SPL. Sound pressure level. So we're looking at over that, but not particularly loud sound. And I can actually, let's hope this works, I can replay these. This is actually quite a quiet snorer. You can just about hear it. And if you talk to any snoring expert, you talk to an ENT surgeon, they will tell you can tell a lot from the sound of the snore as to what's happening within the airway. So that's our quiet snore. That's not too bad. I don't know whether that would disturb any of you during the night. Perhaps it would. I mean, we had an example of a quiet snorer earlier on that's finding it being disturbed. We've also got, so I'm going to have to flick around here, we've also got loud snorers as well. And here's an example of one. This particular subject, this is showing you a long period of time, is snoring up to 90 decibels. Okay, so we're actually peaking at over 90. Now, I think we'd all be disturbed by that, wouldn't we? Yeah. Now that is seriously loud. I shall stop that so that we don't have to suffer too much more of it. Interestingly enough, that particular snorer did not have breathing pauses in between, but managed to snore for very loud levels for long periods of time. But what's particularly fascinating as well to me is that in the same individual overnight, there's a lot of variation in the sound, and that variation is indicating that something different is happening. I believe it is anyway. I can't definitively say that at the moment. So we have sounds such as this. The easiest way for me to do it is this way, I think. Let's hope this works. We've got one period of the night here fairly early on. Very different sound. Sounds very strained now. I can move on to a different period of the night, about 2 hours later. The same subject. Sounding different again. I hope you can appreciate the differences in the sound there. Half an hour later. Sounding different again. Slight different characteristics to the snoring. And then I was surprised to see a rather unusual event towards the end of the night, and I thought, what on earth's going on here? And I discovered when I replayed the sound, nice silence, just hear the clock ticking. So obviously it's clock radio coming on to wake him up at 6 a.m. in the morning, so we can even record that. So we get all sorts of types of snore, and it's very early days, but I am absolutely convinced that we can identify, by analysing that sound, we can identify if those variations actually what they relate to clinically in terms of the airway. Out of interest, I would like to show you this one because I think this is quite dramatic. This is the actual waveform of somebody with sleep apnea. That's actually, if I can zoom in on that, but that's showing 20 minutes across there, and we can see bursts of loud snoring interspersed with virtual periods of silence. And if I replay a section of that, you will hopefully be able to hear just about in the background. If I can find him, there we are. Go for that one. These are occurring regularly as well. There's going to be some silence followed by some very loud snoring and then silence. And hopefully you might just be able to hear in the background the subject actually straining to breathe against the closed airway. It may not be quite sensitive enough to do that. Let's give it a try. That's the airway. And it's closed again. Silence. Unfortunately, didn't record long enough to get the next one, but these silent gaps on this particular individual are around 30 to 40 seconds long, which is a long period of time. And during that time, the oxygen level in your blood is going to be falling dramatically and will have serious effects. Okay, let's see if we can go back to that one now. There we are. So that's the different types of snoring that we've listened to. What does each sound indicate? It's something that I'm will be pursuing over the next few years to try and identify that. Just to give you an idea, because one of the questions that was asked, well, from the snoring, how loud it is, does it actually determine how bad it is, are there greater health effects, etc.? In a very basic study carried out in people's homes, we studied 50 subjects, mean age of 47 years. They had a mean body mass index of 28. Now, body mass index, for those who don't know, is a measure of basically how fat you are, how obese you are. And a normal BMI would be around 22 to 24. So 28 is at the sort of upper end, heading towards overweight. These subjects, we recorded them at home, and we found that we could record very clear, identifiable snoring patterns. It gave us a rapid assessment of the snoring periods and the level, and we were able to see quite clearly these apneic events in patients who had a condition of severe obstructive sleep apnea. They were identified later by overnight sleep study in the laboratory. Out of those 50 subjects, this is the plot showing you the level. So the majority of them had a snoring level around about 70 dB, but there were patients up there at the 80, 85 decibel sound pressure level region. This is a plot of the loudest sound during the night, and some that are actually even greater than that. In the sleep field, we like things called indices. We like a number. We're scientists, you see. We like a number that relates it. So what we do is we measure how many times someone snores per hour. We measure the number of snores over the whole night, and we work out how many times that relates to per hour, a snoring index. And this is to give you an idea of the 50 patients that we studied. So if you were looking at, say, 300 snores per hour, that's going to relate to about 5 or 6 snore minutes. Okay. Well, we breathe typically around sort of 12, 15 times a minute. So we're talking about half the time of snoring there during the night. So the subjects who are up at this, we're talking about snoring which is virtually continuous during the night. So these are high levels of snoring. So this is how often one snores. Being a scientist, I wanted to come up with relationships between various measurements that I made, and sadly didn't come up with very much, apart from there was a general relationship between how loud the snoring is and whether this subject had a high apnea-hypopnea index, which is an indication of whether they're likely to have sleep apnea. So the louder the snoring is, the more likely the subject is to have sleep apnea. That's certainly the findings of that. The relationship's not great, but it certainly showed a trend up there. The conclusion of that study was that we can quantify snoring. We can quantify accurately. We can identify the pattern very easily. In fact, the computer will actually analyse that pattern, identify those individual events. We can see clear apneic events, and we know that not all snores are equal. Not all snoring is the same. And I'm certainly going to be looking for whether we can identify the site of that snoring. There is some evidence that suggests we may be able to. That maybe certain snoring disturbs the sleep of the individual or of their partner. Maybe certain snoring sounds don't. There is, as I say, there is evidence that there's an indication that we can identify sleep disordered breathing from these recordings. And that's the end of my show, and I'm happy to take questions. Yes?
Just a comment really, I think that's really interesting. I've been talking to couples about their sleep. And I had one particular gentleman who actually did categorise his partner's snoring. And his way of dealing with it depended on what type of snoring it was and what time of the night. So if it was a sort of a really loud snoring, he'd have to start either waking her up or going to another room. But he literally had sat down and categorised them and listed them. I think it's quite interesting, that whole perception of snoring and how people respond differently if
according to how they feel, external factors that are making them aware of their disruption and whether they deal with it or not. So I think that's very interesting.
It's performing his own analysis of the sound. And of course that's what some partners say, is that actually they become uncomfortable when the snoring stops. And it's actually that wakes them up, because they think, well, the breathing's stopped as well.
Yes,
So you do get that situation where in some partnerships where the other person actually is comforted by the sound of the snoring because it means their partner's breathing.
Yeah, that's true.
Because this business of proving to somebody that they snore, and in the normal run of things, you don't get tapes long enough, so if I put a tape on at night, that would help.
Absolutely.
But of course you don't know, one night might be different from another, so you don't know when to set the tape for, because you've only got a maximum of, 90 minutes. So that's no good whatsoever.
Absolutely. And the chances are that you may well miss in the first 90 minutes the snoring pattern, because we usually in the first 90 minutes go into a very deep sleep. And often during deep sleep we don't snore. It's during the slightly lighter sleeps that we snore. So you can miss it if you record just the first hour or 90 minutes. There was one over there.
I was interested in the insulin sensitivity. I snore. I've been type 1 diabetic for 35 years. Could that make a difference to my blood sugar levels? Because I know that I don't breathe sometimes because I wake myself up with a jump.
I think the evidence is that yes, it can. And I think it really depends whether it's present with breathing pauses. And that's the issue, really. But certainly there is plenty evidence to suggest that yes, between the breathing pauses in apneic events and diabetes.
So next time I realise that I've made the jump, then's the time to do a very careful blood sugar test.
I'm not sure whether it's that sensitive, actually.
Oh.
We're talking sort of longer term. In fact, no, the human study that was done, they introduced sleep debt over a period of 5 days and did the measurements for 5 days, but they did see a fairly instant effect. So, want the back?
Is your snorometer something that the public will be able to use, or is that just a clinical instrument?
It's a clinical instrument. I would imagine that is available to buy, but it's not really aimed at the general public at the moment. It's very much a scientific instrument for research purposes. There will be nothing to stop the public buying one, apart from find the cost of it prohibitive. But it's primarily aimed initially as a research tool, because we haven't really had the ability to make these measurements, particularly in the home before. And so there's a lot of groundwork in terms of initial measurements. One of the things that I'm particularly interested in is that how variable, not only how variable the snoring is during the night, but how variable it is during the week, long term. Are there fluctuations on a night by night basis? Because in the sleep community, we do tend to do single night instruments. We tend to bring patients into the laboratory to do a one night investigation, and it could be appropriate for snoring. Because you may actually pick the night when it's particularly bad or actually particularly good night.
How valuable to professional recording? For example, if you wanted to go to get treatment by your GP, is that the right process? And
Recording, you mean? I think if you went armed to your GP with a recording, your GP would be forced to take it even more seriously. If you were then referred on to a sleep specialist centre and you went with your own recording, it would mean that you were really taking it.
Given the fact that snoring is related to the airwaves and the muscle tone, and also has the other factors like alcohol and obesity.
Absolutely.
Is there any evidence to say that people with severe sinus problems are more likely to snore?
There is some evidence that nasal obstruction will have an effect on both snoring and on sleep apnea. The effect's perhaps not as great as we would imagine, but certainly there is some evidence that will affect it. So it could tip you over from being a non-snorer into a snorer. So absolutely. And coming from an ear, nose and throat hospital, we would be investigating the nasal air of individuals as well, and perhaps offering them some therapy or treatment to improve that. Okay? Thank you. get out as Marianne wants to.
I think this is the first time in my life I've actually chaired a meeting that's running ahead of time. I was going to tell some jokes just to sort of make us, and so we could rush at the end, but I thought we might as well stick with being on time, which is 4, and then we get coffee even earlier. It's very interesting. In preparation for coming here, I am in now. In preparation for coming here, I actually collect old sleep books, Victorian books, and I actually looked through Robert McNeish's first book, 1830, and I couldn't find any. I've got about 15 of them. I couldn't find anything about snoring except McNeish's book, which he blamed on snuff. So there's a relevant thing. So, but snoring evidently wasn't Victorians, as Raj mentioned. Something that the Greeks, certainly, the ancient Greeks were very interested in snoring, mentioning it throughout their things. So it's interesting now that we are taking it seriously, and that's probably a reflection of how we're taking sleep more seriously, and also relationships more seriously. There weren't that many sex therapists in Victorian times. The other thing is, because I'm talking about, he says about not sharing beds. Now there are many reasons not to share beds with your partner, and snoring being one of them, but he, coming from a great 1830s time, said you shouldn't share your bed with another person because they use up your good air. So that's something to tell. If you can't deal with it snoring, say you're using up all the oxygen. Anyway, enough of me prattling on. I'd like to invite Marianne Davey to come up. She's the co-founder of the British Snoring and Sleep Apnoea Association, which is the kind host of today and the point of today. BSSSSAAA was founded 14 years ago, and from what I was talking just before, is actually going to become a registered charity in the next couple of weeks, which is good news because perhaps that will get it taken a bit more seriously by the medical profession. And so I'd like Marianne to present perhaps the key of today, which is the survey that has recently been carried out. Thank you very much.
Thank you very much, Neil. Now, before I start, let's just get being caffeine deprived. So let's have some water here. And can you all see me here? As I'm quite short. Would you like me to press it down? Any better?
No. Down.
It is going down.
Down more.
How's that? Okay, so less sex for snorers. Is it true or is it false? Well, we know that snoring is deleterious to our relationships. Of course we know that. If you were being kicked and poked and prodded and shouted at all night, you won't be very happy with your partner in the morning. Similarly, if you have to listen to those awful snoring sounds that we heard early on, and if you're kept awake by that all night, you will be tired and irritable in the morning about it. And when we're tired and irritable, we tend to be more argumentative. And argument causes disharmony with relationships. We think this is so, it makes common sense it's so. But is there any real evidence for our common sense thinking? Or is it just assumptions that we're making? Now, we all know someone who snores, and I would say that possibly around half of you in the audience here have been affected by snoring at some time or another. And many of you will be familiar with the scenarios I've just mentioned. And how many times have I heard, I love him to bits, but I hate his snoring, it drives me mad. And if I pound for every time I heard, I would be a very rich woman now. So we know that arguments cause harmony within relationships. And we know this because there's a wealth of academic data out there to tell us so. But can we be so that snoring disharmony within relationships, and in particular, our sexual relationships? So what about current research? Well, we've heard today that there's a wealth of academic literature concerned with snoring, causes, treatments, and a whole range of conditions associated with snoring, and indeed sleep apnea. But there's very little concerned with the psychosocial or the psychosexual effects that snoring can have. So what I want to explore today is whether our thinking and assumptions about whether snoring does have a deleterious effect on our relationships and in particular our sexual relationships, is in fact correct. So how do we transfer our assumptions into robust clinical data? Well, we have to ask questions, and that's exactly what we did. We asked visitors to our website to complete an online questionnaire. Now, the questionnaire was of a very intimate nature, I have to say. It related to the health of their relationship with their partner, related to their sexual relationships, particularly to licking, invasive. And perhaps people thought maybe this was rather flippant, perhaps a little cheeky, and definitely invasive. And had we been in the street asking these sort of questions, we would have got quite a few indignant no's, I'm not answering that, and at worst maybe a few slaps in the face. But how else do we get clinical data if we don't ask the questions? So we had to do it. And of course my main worry was really, would anybody answer these questions from our website? And I did worry about that quite a lot, but thankfully, and with great relief, with the first week we got our target data of 1,000 responses. Now before I go into the results of the study, I want to just remind you of facts and figures about snoring. 15 million snorers in the UK, 10.5 million of those are men and 4.5 million are women. And together, we put the snorers with their bed partner, we're looking at about 30 million people in the UK who are affected by snoring. And if we take that a step further, 30 million people, my goodness, that's nearly half the nation. That's a lot of people. How many other conditions do we know that directly affect the health of another? And in this instance, we're looking at the bed partner. Not only does it affect their health due to the sleep deprivation that the snoring has caused, but it also affects their mental health, and we'll see why this should be as we go through the presentation. So let's get on to the study and go through the demographics first of all. We had our 1,000 respondents, 53% were male, 47% were female, 69% were snorers, and 31% were partners of snorers. 48% were snoring males. And we had 22% snoring females. And I'm really glad to see that figure of 22% snoring females. Not particularly because I'm glad to see that females are snoring, but in the past we found it very, very difficult to get women who snore to come forward and answer the sort of questions that we wanted answered this time round. I think in the past it was really considered to be females don't snore, only men snore. It's very embarrassing for females to come forward and acknowledge that they have a problem, and even worse, to go and seek help. But I think the fact that we have got 22% snoring females does make for good data. So carrying on, we have 25% female partners and 5% were male partners. But is there a slight bias towards males? Well, I think ever so slightly here, when we see we've got just over half of all respondents were male and just under half were snoring males. So why should this be, do we think? Well, I think probably the answer is staring at us. Less sex for snorers probably appeals far more to the male ego than it does to females. I'm sure any male who looked at our website and saw less sex for snorers would probably want to find out more. But let's look at this more logically. We know that 2/3 of all snorers are male, and we do know that most males would be interested in more sex, and I don't think we need another study to qualify that one. They will want to find out if their experiences and views are shared by others in the same situation. So I think that probably explains the bias. So let's just finish up with the demographics. Good age range, 20 to 80 plus, makes for good data. However, most of the respondents were clustered around the 30 to 60 year age group, but that's what we would have expected. It's snoring, middle age. Overwhelmingly, both snorers and partners said that snoring was every night. And we had 78% of snorers said it was every night. Slightly more partners said it was every night. Slight discrepancy there with the responses, but it doesn't seem very much, probably not worth mentioning, but as we go through the presentation, discrepancies in responses might actually mean something to us. So to finish up demographics, just under half of all snorers have always snored. So on to the questions. The first question we asked of the partner, what are your feelings when being woken by snoring? And we had frustration, upset and anger, predominantly frustration. And we asked the same question of the snorer, how do you think your snoring affects your bed partner? And very, very similar responses with predominantly frustration and then upset and anger. But we also had hopelessness, hate and not bothered. I'm a little worried about the not bothered, but I'll explain that in a moment. You can see at the bottom here I've put a quote from one of our respondents, and you'll see these quotes all through the presentation. And I thought it was important to put them in there so that you could see what people are actually saying to us. So we asked the snorers, how do you feel about your snoring? Embarrassed, isolated, rejected, angry, not bothered. So why am I particularly bothered about not bothered? After all, only 9% of them said they weren't bothered about their snoring, whereas 33% were embarrassed about it. But if we go back to where we were looking at our figures, 15 million snorers in the UK, 9% of those 15 million are probably not bothered about their snoring. That's quite a few snorers. So we can work that out quite easily. 9% of 15 million is just under 1.5 million snorers who are not bothered. But look what one of our respondents is saying to us. My partner does not acknowledge that snoring is a problem. Well, it isn't a problem for him, is it? And so we can see here that she's probably not the only one who is thinking like this. Very many partners of snorers have that view. And so I think we need to take these 9% who are not bothered and perhaps try and impress upon them the fact that it is having an effect on their partners. Now we asked the partners, do you feel if you have sufficient sleep? Massive 81% said no. How do you feel in the morning? Tired and irritable, they said. Unable to work properly, headache, or none of these. And look what they said to us. I want him to stop snoring and waking me in the middle of the night. The lack of sleep makes me tired and resentful. My partner's snoring is greatly affecting our relationship. We are close to splitting up as a result of the lack of sleep. And that's a terrible situation to be in. Now, when I was researching, I looked at a Mori poll that was conducted last year concerned with British sleeping behaviour. Now, they weren't looking at snoring in particular. In fact, I don't think snoring came into it. But one of the questions they asked their respondents took my eye. And what they asked their respondents, thinking about the last time you were tired, how did you feel? And they said irritable and shouted. Now, if we think back to the last slide, and we were asking our partners of snorers, how do you feel about being woken by snoring and how do you feel in the morning? They said tired and irritable. So we can see already that our data is not so dissimilar to that of other research. But going back to the Mori poll, thinking about the last time you were tired, how did you feel? And 22% said they argued with their partner. So not only are they irritable when they're tired, they shout and they argue with their partner. So remembering that this is nothing to do with snoring, but when we come on to our results with snoring and arguing, that is very relevant. Now, looking at some work by a man called Madani, I thought I'd put this quote up because it rather made me chuckle. Sleep deprivation due to a partner's snoring makes it a challenge to be cheerful in the morning and can have a negative effect on the rest of their day too. Now, if any of you have slept with a snorer and been kept awake by them all night, you will know that it is very difficult to be cheerful in the morning. In fact, I think we're pretty grumpy if we've been kept awake by snoring. And as for having a negative effect on the rest of your day, I think we could probably say it probably ruins the whole day. So it really does have an impact on the bed partner. But looking at Madani's work, he studied 5,000 of his snoring patients. And he discovered that over 80% of snoring couples sleep in separate bedrooms. And already today we've heard quite a lot about the sleeping in separate bedrooms. So when we asked our bed partners, do you ever sleep in another room because of snoring? Massive figures again, 81% of them said yes. How do you feel about that? Relieved, resentment, upset and anger again. And interestingly, when we asked the snorers the same question, only 69% of them said they sleep in another room and they're upset about it. So why have we got this discrepancy in responses? Only 69% of snorers, but massive 81% of partners said yes. Well, I think I can explain that one away to a degree. What we actually asked the snorers was, do you ever get asked to sleep in another room because of your snoring? So it may be that if the snoring's been going on for months or years, that the partner actually gets fed up with asking the snorer to go, so they just get up and go. It's much easier for them. But I've ringed the 81%. So if we think back to our 15 million snorers, we're assuming that most of those 15 million have a bed partner. So 81% of 15 million, we're looking at roughly 12 million bed partners who are saying they sleep in another room because of snoring. I thought you'd like to see this. It's a quote from one of our respondents, and he's saying, I now sleep in another room. I sleep in a hammock in the spare room, and I'm enjoying the best sleep I have had for 20 years. I simply got fed up with being hit all the time for something I have no real control over. Now, I put that there because it just demonstrates that it's not only the bed partner who's affected by the snoring, and as we see here, this poor snorer has to suffer grievous bodily harm every night. So of course it's going to affect him. Now, why a hammock? I don't know, and I'd love to know the answer to that. So you can leave your answers on a piece of paper and let me see them later on. Now, going back to our 80% of snoring couples sleep in a separate room, it may be that quite a few of them actually choose to do that. And once again, we've heard quite a lot of that from Robert and Raj about really, it's quite good sometimes to sleep in a separate room. Of course, we have to remember that there are snoring couples who really cannot get away from the snoring. They don't have a spare bedroom to go into. So what do? Well, inevitably, one or other of the partners will end up downstairs sleeping on the sofa. Now, any of you here who have spent one night on a sofa will probably know that it's pretty uncomfortable. If you spent a week sleeping on the sofa, that's pretty awful, and you've also got a backache. But if you spend a month sleeping on the sofa, that is intolerable. It's awful. You've got a backache, and you are tired, irritable, and grumpy in the morning. And once again, that doesn't make for a good relationship. So we asked our partners, do you ever argue about snoring? And 51% of partners and 41% of snorers said yes. Now again, we've got this slight discrepancy in responses. So why is it that 51% of partners said they argue, but only 41% of snorers say they argue? It's quite a big difference, 10% difference here. Well, I think I can explain that one away. Looking at some work by Faulkner, he's suggesting that the wives are more likely to start an argument because they see the husband as being the cause of the problem. And in this case, it's the snoring. On the other hand, the husbands don't see it particularly as being their problem. It's more their problem. And they really don't want to get into the argument. They tend to withdraw from it. So what we've just seen just now, where we have 51% of our partners say they argue, but only 41% of snorers, Faulkner's observations might explain this difference, where of course the wife wants to start the argument, she wants to stop the snoring, but the husband doesn't really want to get into that sort of row. And also, if we go back to where we were looking at how does the snorer feel about his snoring, and we had those 9% who weren't particularly bothered. And I've put that quote up again to remind you, my partner does not acknowledge that snoring is a problem. Well, it isn't a problem for him anyway. And once again, this might really demonstrate Faulkner's views on the attitudes of men and women's attitudes to arguing. Now, on to relationships. Staying with Faulkner, marital conflict is more common in unhappy marriages. Marital conflict produces high levels of negative emotions such as anger, fear, and sadness. And what have we seen so far? All those negative emotions and the sad emotions. When very first question we asked our bed partner, how do you feel about the snoring? Upset and angry. And then we said, how do you feel about sleeping in another room because of the snoring? Angry and resentful. And also when we asked the partner, how do you think your snoring affects your bed partner? They said upset and angry. So we can see these are high levels of negative emotions. And when we asked the snorer, how do they feel about their snoring? They said embarrassed, rejected, isolated. Again, these are high levels of sadness. So we can see once again the results of this study are very, very similar to other research. Staying with Faulkner yet again, women are more likely to be attuned to the emotional quality of marital functioning and more sensitive to events that occur in the relationship. And let's go back again to what we've just said. The woman, of course, is more attuned to it. She's the one that's being affected by the snoring. So, of course, she wants to mention it. Maybe doesn't want to start a row, but that's probably how it ends up. But the husband doesn't see it particularly as being his problem. So he's not in tune with what's going on in the relationship anyway. And he certainly doesn't realise what a problem it is for the partner. So once again, we can see here our results are very similar to that of other research. Now, some further reading here, and also when we asked about relationships, would your relationship be better if snoring stopped? Massive figures again, 85% of partners and 88% of snorers said yes. And look again at what they said to us. It might make our relationship stronger. It destroyed my first marriage and cost me my career. My partner said that my snoring contributed to him wanting a divorce, which we are currently going through. And again, that's a really sad situation to get into because of snoring. But Almeida is suggesting that perceptions of marital quality are undermined by recent negative interactions. And what does snoring do? It makes us argue negative interactions. Snoring, arguing, undermines the quality of relationships. And what these respondents to our survey are saying, if snoring stopped, we wouldn't argue and our relationship would be better. Unhappy spouses have characteristically negative communication and interactional behaviour. They tend to blame their partners for their marital problems and often feel hostile in trying to bring the problem to a resolution. And Raj mentioned that in quite a lot of detail. But this statement here really reminds me of a consultant friend of ours that we work quite closely with. And when being there, and first of all, he sees them both individually, ask the same question, but separately. Then he brings them back together and asks pretty much the same questions, but as a couple. And what he finds is that the responses they gave as individuals now turn out to be quite different to the responses that they give as a couple. And quite often what he finds is the bed partner is exaggerating the symptoms. Now, why should this be? After all, they've both come for help, so why should the bed partner exaggerate the symptoms? Well, I suppose we could understand that in a way. It's the bed partner that is generally affected by the snoring, and I suppose she goes with the view that if she exaggerates the symptoms, it accelerate the treatment and stop the snoring. So we could understand that. Of course she's in a hurry to get the snore resolved, affecting her life. But the consultant also has another alternative, which might explain this particular statement. He's suggesting that the relationship is breaking down anyway, and that snoring is just another contributing factor to the breakdown, and that the partner is just used snoring as an excuse. It's just something else in the list of things that she doesn't like about her partner and the relationship. And besides, it's a jolly good excuse to sleep in another room. So we're on to our sex relationship now, and we asked, does snoring affect your sexual relationship? 59% of partners and 55% of snorers said yes. And once again, we can see here that it seems to be affecting the partners just a little more than it does snorers. But going back to Madani, He's suggesting that patients realise that snoring is a social challenge, and I think we know that now. But it turns out that snoring can have a negative effect on the sexual function of the snorer as well. And did we know that? Probably not until today. A significant number of heavy snorers have reduced sexual drive, and over 50% of snoring men experience erectile dysfunction. Now, it seems to me that from what we can see here and from what we've learned just now, surely is this not a good reason and a very good motivator to stop snoring? Frequency of lovemaking. 31% of partners and 26% of snorers said they hardly ever make love. Would you make love more often if snoring stopped? And hooray, actually agree on something. Yes, they would make love more often if snoring stopped. But what is it about snoring? What is it that makes people say they hardly ever make love because of it? And what is it about snoring that makes them say we'd make love more often if snoring stopped? Well, I can't tell quite what snoring stopped. So how can we help in trying massive partners, and they would like, and we help? Well, we must let them, of course. Well, I think from the result that snorers favourable love snoring. So I'm going to just finish now, and we'll summarise first of all. Snoring causes sleep deprivation. It causes arguments. The woman's more likely to start the argument because, of course, she wants the snoring to stop, and this in itself causes arguments. The snorer is not always particularly bothered about the snoring. He doesn't see it as a problem, and it causes disharmony within the relationships, and the relationship suffers as a result. And what they're saying to us, they would like help. Now, I want to leave you with a quote from a respondent to the survey, who, well, I can best explain it as he's probably raised an alternative coping mechanism to the whole problem. You are assuming that sleeping and lovemaking are related activities. My wife and I have always made love during the day because our jobs are such that we're too tired at night. Besides, when you make love in the afternoon, you can have a cup of tea afterwards. Any questions? Yes.
Actually, that might sound like a big joke at the end, but actually I think there's quite a simple explanation to the sex thing. My ex-wife would always go to bed first, at least an hour before I did, because at least she'd get to sleep before I went to bed. And as a male, some of us would have to hold our hands up and say that once we've had our 15 seconds of great excitement, we tend to go to sleep immediately, where the woman doesn't. And I think that is the start of where all of that happens. They don't want to have sex because the guy can just go to sleep straight away afterwards, and the woman stays away.
Yes, and I think also you sort of hit the point here that it addresses some of the issues. Maybe if a lot more of snorers and their partners were to make love during the day, that would overcome that issue. But we mustn't forget that snoring, if you're in bed with a snorer, that is still a problem. So he has addressed some of it, but perhaps not got there completely. Any other questions?
How about the ages of people? I mean, was it, say, 50-year-olds and after who were sleeping apart?
Well, most of the respondents to our questionnaire were clustered around the 30 to 60 year age group, which is exactly what we would have expected because that's really the majority of snorers in that age group. Generally after the age of about 70, you find that snoring actually starts to decrease.
Because you can't hear it anymore anyway.
Well, that's probably it. And probably by then the partner is snoring as well if they're the same age. Anything else? Okay, thank you.
Yes.
Brought tea forward to about 12:15.
Okay.
So
fill in for 25 minutes with jokes. Well, thank you for the 3 good presentations. We do have 2 more questions for you to answer, and then we can get into a discussion, question and answer, telling joke situation. It's down to you how that goes. So can I have the 3rd question, please? Get your remote controls out. And with the mysteries of technology, something will happen soon, I hope. There we are. Okay. Which of these statements do you most agree with, having heard the presentations today? Snoring, for one reason or another, causes lack of sex, which in turn causes marital disharmony, or snoring causes marital disharmony, which results in less lovemaking. That is your view, not what you've been told, but how you feel about it. Vote now. There we are, answer now. It's up there. Okay, and the final question. For embarrassing problems like snoring, what would you use or advise others to use as your primary source of information? Net such as www.britishsnoring.uk, telephone advice lines, the library, or the port of last resort, doctors. Some people have got a lot of faith in doctors. Well, thanks for that. It's very interesting. One of the questions from the floor from my colleague Sue Venn from the University of Surrey was very interesting because it reminds me that they've been looking at couples, but they did a research into women, sort of middle-aged to the more, I've got to think, she's a sociologist, so I've got to think of my terms properly. I would call them old, but that's probably a bad thing to say. And the interesting thing about the women who did admit to relocating is that they relocate in the middle of the night. And that surprises me. I've got nothing against people sleeping in separate rooms, but it's bizarre that people who have lived together for years and years and years, suddenly in the middle of the night, it is a surprise. Oh, he's snoring again. I'm going to relocate. Why don't they relocate at the start of the night? Because they know that's going to happen. And it's that resentfulness. Nobody ever sleeps in each other's arms. That's a Hollywood myth. You can't lie together for more than 5 minutes without getting pins and needles. And then you finally say, good night, meaning I'm going to the other side of the bed now and don't come anywhere near me because I want to fall asleep. So why not at that point the person go off to the separate bedroom and go to sleep rather than waking up going, oh God, is it going to stop? No, it's not. Oh, I'll go. And that's the resentment. And the whole thing about waking up in the middle of the night or being awoken in the middle of the night is resentment. If your partner snores, that annoys you. This is where it gets personal, if your cat comes in and snuggles into bed and licks your face and tells you how wonderful you are, you think, oh, that's cute. And you don't resent the cat. You don't kick the cat out. Well, rarely. This morning I did. God, it was raining 3 times he comes in, soaking wet. Ooh, look at me, I'm wet. Oh, yeah, okay, So I did kick him out. But you rarely resent certain disturbances. And it's the fact with snoring. If you don't hear it, you don't resent it. And the reason women only hear snoring in the middle of the night is because you're in deep sleep for the first half of the night, and your auditory threshold is, when we're actually at the moment trying to disturb people out of deep sleep, and we're using up to 105 decibels SPL, and it's making no difference, not even hearing it. So you won't hear somebody snoring, even one of Robert's sort of classic snores, you won't hear them. But then in the latter part of the night, after the first 3 hours or so, your sleep lightens, and that's it. oh, he's snoring. Well, he's been snoring all night, you just haven't heard him. And that's when you get up. So if you're going to have separate rooms, get up and go to the separate room early. And then you can have that little romantic thing of tiptoeing down the corridor across the landing in the morning. Because that's the way to have good sex, is to actually be awake. And that didn't come out quite as I had imagined it would do. But anyway, but it's much better to tiptoe down the landing for sex than have an arm thrown over you because you happen to be there. So there is something to be said, but taking sleep seriously and anything that disturbs sleep is important, and snoring is one of those things. So sorting out snoring is an important way for good physical, mental and emotional health, and that was completely unprepared, and I don't know why I did it. Please, people, talk to me or talk to... Go on, Sue, thank you. Of course you can.
The one about relocating in the middle of the night, a lot of the couples said to us that the last thing they wanted to do was relocate at any time, and that goes for the men and the women. And a lot of the times it was the men saying, please don't go, I hate it when you're not in the bed. So it was both men and women saying they didn't want to relocate, whether it was the start of the night or in the middle of the night or whatever. The other thing is, a lot of men we spoke to fell asleep really quickly and started snoring straight away before the partner's asleep. So there's an issue there about not only being woken up in the middle of the night, it's a case of get to sleep before they start snoring, or lay there listening to them snoring at the beginning of the night.
I mean, there is this culture. I mean, I don't know if you know history of beds, but it was only in the late Tudor age that we actually started thinking about sharing beds. And that was because we had to get up off the floor, because we used to sleep on the floor and it was really quite disgusting. So we invented beds. You know, it was a sort of pretty much a family affair, sleeping at those times. But we are the only animal that relates sleep and sex. We even have the same word for it. If your teenage daughter came home of an evening and said, I'm sleeping with this young lad, you wouldn't actually think that sleeping was the thing she was doing. So we're the only animal that relates sleep and sex. And there is a social taboo about intimacy, about sharing the marital bed. And if you, for whatever reason, get out of the bed and relocate, somehow your marriage is disastrously over. And that's why people feel against the idea. Anybody who says, I like knowing my partner is next to me in bed, is a disturbed sleeper, because the only way you're aware of somebody in bed is by being awake. So they will be disturbing you. So it's that cultural myth, and we shouldn't be... Yes, of course, if you know, but when you're a child, you have a single bed. A single bed is 2'6" or 3 foot wide. When you're an adult, you buy a double bed, which is 4'6" wide. So you have 3 or 9 inches less sleep space than your child. You then put this strange creature next to you who makes very funny noises and fights you for the duvet. And is it any wonder you don't get a good night's sleep? So a lot of things, people need to think, buy a bigger bed. Buy twin beds that you can, in the middle of the night, push apart. Get away from me.
That's also ignoring the number of people who don't have those choices on large level with small children, even with teenage children. You end up with everybody else's teenage children. They don't have that choice. Oh, I think I'm going to sleep in another room.
Earplugs. Earplugs.
Sometimes they'll leave a snoring partner where they fall asleep snoring, which is enough for them. I'm going to relocate myself away from this.
But
A lot of people don't have those choices.
no, I know. I mean, that's why somebody mentioned it's the Queen and Prince Philip don't sleep together. It is a thing of the rich and also of the middle age, because the kids have flown the nest. Well, in these days and age, there's this thing in the mail today that a lot of 30-year-olds are actually bailing their parents out. God, there's no hope for us, was there? I mean, I grew up during Tomorrow's World. They promised me a paperless office. I'd work 3 days a week, and now I'm going to have to support my parents. Yeah, it's not looking good, is it? Anybody else want to say something? Because, God, I can talk.
I think there's good evidence here for sofa makers to make something a little more comfortable too, don't you?
But yes, I mean, we don't have those sort of American reclining chairs. What are they called? Lazy boy? What are they? Yeah, the ones they have on Friends. We should have, every man should be given one of those, so the wife can just tip him over at the end, you know, when he falls asleep in front of the telly and leave him there.
I don't think it's the noise that keeps you awake at night. It's the snoring that keeps you awake at night. And there's a differentiation between the two. When you've got the snoring, it's not a regular noise. And therefore you're listening for the next one. Has it stopped? You're, as you say, are they still breathing? And you're then starting to get aggravated, and the whole of the emotion comes together. I can suffer that right the way through the night. When he gets up in the morning, I can go to sleep. I have two daughters who seem to think that the only mirror in the house to do their hair in is mine. They come in, they both come in, they turn the light on in front of the mirror, they turn the hairdryer on, and they can be in there between them for up to 3/4 of an hour doing their hair. They can go out and they then leave the house. Don't hear a thing. But all night I have been woken up, and funnily enough, it is at certain times. I can wake up and I don't know why I'm awake, and I look at the clock and they are at certain times. And I've then got to turn the light on or stop snoring. I've then got to leave to get tired again. As soon as I get to the point of dropping off and I pull that light, straight away it's just up again.
I mean, I think that's it. I think it's the meaning that you attach to sound and the noise. You know, mothers are very much more in tune to their children. Fathers actually are in tune more than couples who don't have children. So if your husband's lying there saying no, didn't hear it, he's probably selectively deaf. But they are, both parents are actually sort of hardwired to hear their children, and it is perhaps something to do with you know, being in a couple, that there is an acute awareness of the meaningfulness of the sound, and certainly in something like sleep apnea, where you get the pause, and you know, as Robert's shown, you know, 30-40 seconds, that's a hell of a long time at 4 o'clock in the morning with the lights turned off, thinking, well, has he died? Oh no, he hasn't, he's snoring. Well, I'm not sure which one I prefer, but you know, you've got to see that there is perhaps a resonance to noise. I mean, I don't know if any of you can hear the ticking clock in here. You know, that would, if that was in my house, I'd have to hunt it down and kill it before, even at that level, it is annoying me so much, or it would do at night in a quiet house. And when I stay at friends, I've been known to be sort of traipsing round trying to pull batteries out of clocks in the middle of the night. Just one of my few perversions. And you know, so it's how meaningful that sound is, and how much you resent it. You know, if you wake up and you lie there and think, oh God, I'm never going to get back to sleep because he's snoring, you probably won't get back to sleep. Whereas if you have the luxury of turning over and zoning it out, then you probably will get back to sleep.
Is there any issue there of the sleep cycle as well, where you're more aware of certain things at various times during the night?
Robert, do you want to answer? Because I'm doing a lot of talking.
Absolutely, absolutely. I mean, we've heard about the deep sleep, light sleep cycles that we go through, which are approximately every 90 minutes. So a 90-minute period in the early part of the night, you'll be in deep sleep for a significant portion of that before coming out to a light sleep. And the deep light ratio changes in favour of the lighter sleep the later on in the night. And then we have the REM, rapid eye movement sleep, which is a very light form of sleep from which you're very easily disturbed. So the fact that it happens to be certain times of the night if you are a regular sleeping animal and you go to bed at the same time, would make absolutely perfect sense because it's tying in with you coming up into a light phase of sleep. So I think I'll just make one other comment about noise, because we do actually have a different scale for measuring noise at night time, because at night time noise is more annoying. It's more annoying, A, because we should be asleep, and B, because it's so quiet everywhere else. Whereas during the day, the same sound with other background noise would be more acceptable. And I think that's one of the reasons why people are so against aircraft noise at night time, because of the significant disturbance it has on their quiet environment, whereas one would hardly notice it perhaps during the day.
Two quick questions. Lifestyle was mentioned earlier, and alcohol. Now, if you knew something was coming to stay, do you just stop drinking for weeks, or do you just not have a glass of wine when you go out for a meal?
I mean, alcohol is about sort of loosening the muscle tone and that sort of thing. So it's avoiding that evening drinking and saying a tennis ball in the back of your pyjamas.
And the other question is, if it were decided that surgery might be the answer, is that likely to have any effect on one's speaking or singing voice?
I'm not the man to answer that.
An ENT surgeon out there.
It shouldn't affect it at all. So nowadays, the way the world is, you have to sign a long form saying you do understand the risk factors, and I suppose there are theoretical reasons. If you do too much, if you talk to later surgery, you take too much, it can give a rather open voice.
I do a lot of singing, that's what I do.
It shouldn't affect it, but I think the surgeon, you need to have a very good discussion. But I think an awful lot has been said today, and I think that we mustn't go away feeling very negative. I'm getting sort of feeling that it's all gloom and doom. There's so much could be done for snoring now, so much. And when you've gone through all the lifestyle things and sort of weight loss and so on, there remain three pillars of treatment. One is surgery, of which there's a number of range, but laser surgery is really good for selected people. The second is, of course, the device for bringing the jaw forward, which works for me. I mean, my wife said, look, you guy, you're meant to be treating all this, and you snore terribly. So I went and had one fitted, and it's absolutely transformed me. When I went to go on a boating holiday with some male friends, it gave me confidence that I wasn't going to run this kick out. And it's simple, cheap. And the third way, of course, is CPAP, continuous positive air pressure, which is particularly good for sleep apnea. Now, those three things, all available through the NHS, great to the listeners, don't worry if you live. And so I would urge people just to go to their GP and get referred to an ENT surgeon who has an interest in snoring, because he can usually do things to help. He or she.
There is another one with no sex and snoring. I went to King's Cross Sleep Clinic many years ago and spent the night with a nurse. In the morning she came with a shaky cup of tea and she said, I've never heard anything so awful as your snoring. My advice to you is never to sleep with your mistress.
I think it's true that there are things to be done, and the simple expedient things. Lifestyle is an important one, and it's something that perhaps isn't. People don't like giving lifestyle advice, and as was mentioned, saying to a woman you snore somehow has this hidden meaning of I think you're a bit fat. Hidden inside that, so woe betide any man who would ever say that. But yes, there are things to be done, and if it's relocation, earplugs, surgery, CPAP, there are positive things. But the most important thing is to take the situation seriously. It's not a joke. I mean, just before I came in, I did a radio interview on BBC Three Counties, and I know Marianne did an early recorded piece. And the DJ was called something like Big Al or something like that, so you knew he probably had a problem. And he basically took the mickey. Okay, it's an early morning show, you don't want anything too serious, but it is, there is every single sitcom on the planet uses snoring as a humorous device. But it is a serious thing, and the consequences and the fine line between snoring and sleep apnea needs to be taken seriously. And if people think about snoring, they'll also perhaps think about getting a better night's sleep, and that can only be a good thing. And now I'm going to ruin it all by saying, go and take some caffeine and wake up. Unless anybody's got anything else to say. No, I bored you into submission. I would like to thank the British Snoring Sleep Apnea Association for hosting this event. Thank you very much for your participation. Thank you very much to the speakers for their entertaining presentations, and I think a round of applause for everybody involved would be a good thing. Coffee served outside.
Tea should be served in the lounge, which is just sort of in that direction. So
That's
you can go
right.
right. That's it. And we have some brochures for you too, Marianne. This one, and I'll go over here.
Oh, hi, how you doing?
Please pick up a leaflet on the way out.